Hi, welcome to our telehealth video information series. I'm Garvin and this video is on Orencia. So what is Orencia used for? It's used for moderate to severe rheumatoid arthritis, also arthritis with no known cause affecting several joints, and in children aged 6 years and over. So Orencia, or abatacept, the chemical ingredient, is used in combination with methotrexate when other disease-modifying anti-rheumatic drugs, or DMARDs, including TNF-alpha inhibitors such as infliximab, have not been effective or not tolerated. This medicine has not been studied in children under 6 years of age. So how does Orencia work? Orencia infusion and injection contain the active ingredient abatacept, which is a type of medicine called a selective immunosuppressant. It is used to treat severe forms of rheumatoid arthritis. Rheumatoid arthritis is known as an autoimmune disease because the inflammation and damage to the joints results from overactivity in the immune system. Abatacept works by suppressing part of the immune system and modifying the process of inflammation. Abatacept works by binding to cells called antigen-presenting cells, which are important cells in the immune system. By binding to the surface of these, abatacept prevents them from binding with other important immune cells called T lymphocytes. Normally, when antigen-presenting cells bind with T lymphocytes, this activates the T cells, setting off a chain reaction that results in inflammation. The activated T lymphocytes multiply its numbers and directly cause inflammation themselves. They also produce substances that cause inflammation, such as interleukins and TNF-alpha, as well as activating other inflammatory cells. By preventing the antigen-presenting cells from binding to the T lymphocytes, abatacept stops them activating the T lymphocytes. This stops the T lymphocytes from producing these inflammatory responses. In arthritic conditions, treatment with abatacept reduces the movement of inflammatory cells into inflamed areas of the joints. This reduces the signs and symptoms of arthritis, improves physical function of the joint, and reduces the rate of joint damage. It also reduces the presence of other inflammatory markers. When treating arthritis, abatacept is referred to as a disease-modifying anti-rheumatic drug, or DMARD. So how is Orencia given? Abatacept is only given under the direct supervision of specialists. It is usually given as a drip into a vein, that's intravenous infusion, over a 30-minute period. This is repeated 2 and 4 weeks after the first infusion and then at further intervals. For adults aged over 18, abatacept can also be given as an injection under the skin once a week. If appropriate, your doctor may be able to teach you or your carer to administer these injections yourself. In this case, you will need to carefully follow the instructions given by your doctor, as well as those printed on the information leaflet supplied with the injection. If no improvements in symptoms have been seen after 6 months of using the medicine, it may be necessary to stop treatment. So Orencia should be used with caution in elderly people, carriers of hepatitis B, people with dormant tuberculosis infection, and people with a history of recurrent infections. Also people who have recently been receiving treatment that suppresses the activity of the immune system. For example, long-term corticosteroids, chemotherapy, radiotherapy, and medicines to prevent transplant rejection. Also multiple sclerosis, people with a history of recurrent cancer. Orencia infusion contains sodium, which should be taken into consideration for people on a controlled sodium diet. Orencia subcutaneous injection is sodium-free. And Orencia is not to be used in active tuberculosis, severe and uncontrolled infections, infections of the blood or body tissues, and infections due to lowered resistance of the body, for breastfeeding, Orencia subcutaneous injection is not recommended for children and adolescents under 18 years of age. Orencia infusion is not recommended for children under 6 years of age. This medicine should not be used if you're allergic to any of its ingredients. Tell your doctor or pharmacist if you have previously experienced such an allergy. If you feel you've experienced an allergic reaction, stop using the medicine immediately and contact your doctor. So for pregnancy and breastfeeding with Orencia, the safety of this medicine for use during pregnancy has not been established. The manufacturer states that it should not be used during pregnancy unless considered absolutely essential by a doctor. So speak to your doctor for further information on this. Women who could get pregnant should use an effective method of contraception to prevent pregnancy during treatment and for at least 14 weeks after their last dose of this medicine. It is not known if this medicine passes into breast milk. Women should not breastfeed during treatment with this medicine or for at least 14 weeks after their last dose. So the main side effects of Orencia would be upper respiratory tract infections such as infections of the nose and throat. Also lower respiratory tract infections, for example chest infections such as bronchitis or pneumonia, urinary tract infections, cold sores, conjunctivitis, and decrease in the number of white blood cells in the blood, headache, dizziness, pins and needles sensation, an increase in blood pressure, flushing and cough, disturbance of the gut such as diarrhea, indigestion and abdominal pain, mouth ulcers, skin reactions such as itching and rash, and hair loss, feeling weak or tired, and injection site reactions, and alteration in results of liver function tests. And very rarely, the side effects, infections of the skin, nails, kidneys, and blood, decrease in the number of platelets in the blood, an increased tendency to bruise, depression, anxiety, and palpitations, and lower blood pressure, wheezing and shortness of breath, and inflammation of the stomach or gastritis. So the side effects I've mentioned may not include all the side effects reported by the manufacturer. For more information about any other risks or side effects, you need to read the patient information leaflet that comes with the medicine or talk to your doctor or pharmacist. So how can this medicine affect other medicines? It is important to tell your doctor or pharmacist what medicines you're already taking before you start treatment with Orencia. Similarly, check with your doctor or pharmacist before taking any new medicine while having treatment with Orencia to make sure the combination is safe. Abatacept is not recommended for use with the following medicines, as the combination may increase the risk of serious infections without an increase in effectiveness against arthritis. So adalimumab, anakinra, certolizumab, etanercept, and infliximab. There may be an increased risk of infections if this medicine is used to treat people who are or who have recently been receiving treatment that suppresses the activity of the immune system. So for example, long-term oral corticosteroids, chemotherapy, radiotherapy, or medicines to prevent transplant rejection. This medicine suppresses part of the immune system. That means that vaccines may potentially be less effective if given during treatment, and live vaccines may cause serious infections. So live vaccines include measles, mumps, rubella, MMR, oral polio, oral typhoid, and yellow fever. It is recommended that live vaccines are not given to people being treated with Orencia or within 3 months of stopping Orencia. Children having this treatment should be brought up to date with their current childhood immunisation schedule before treatment is started. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through our website, mytelehealth.info, or call into us at Lynch's Pharmacy, Douglas, Cork. And you can ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.